Thank you so much for joining us on this episode of Family Matters. Once again, I'm Purity Museu, and we start by focusing on the plight of persons living with disabilities. And this conversation is coming at a time when March 1st is a global commemoration of Wheelchair Day. And this day is marked to just celebrate this wheelchair as one of the things helping persons living with disability in the cope up with the situation in the country. So my guest tonight, Susan Nafula, Legal Officer, National Council for Persons Living with Disabilities, and Benson Ibagesa, who is the Programs Officer at the Association for the Physically Disabled Persons in the country. And lastly, at the far end, we have Bright Oywaya, thank you, NTSA Executive Officer. Thank you, ladies and gentlemen, for joining us tonight. Okay, let me begin with you, Bright. Tomorrow is an important day for persons living with disability. When we look back, Bright, how far would you say as a country we've come from? You know, is it now a bit easier for persons with disability, or how would you rate us as a country, I mean?
Thank you. First of all, I would like to clarify that I'm no longer with NTSA.
Okay.
But as a person living with disability and using a wheelchair, we've made some strides, but there's still a long journey to go. We begin by realizing that in 2003, we put into place the Disability Act that has never been operationalized. In terms of the content, in terms of accessibility, in terms of access, in terms of built environments, the challenges we were facing 10 years back, we are still facing today. Though a few buildings here and there will be found with ramps, with accessibility places, but why would it be that persons living with disability, especially those who use wheelchairs, still feel like it's an afterthought? So we've made some strides, but we are far from over. We need legislation, we need what is it called? We need to enforce. We need to bring it to life. And we need to realize that people living on wheelchairs don't just want tokenism. They want to live a life that's real, a life that's free, a life that's accessible.
Benson, will the persons living with disability tomorrow in Kenya be really celebrating this day? I want you to address the issue of accessibility of this commodity by persons living with disability. Do we still have people struggling to find this or to acquire this?
Thank you very much. Maybe I'll start by saying, according to WHO, the need for wheelchair service or wheelchair to persons with disabilities is at 1%. When you look at the population in Kenya, as per our previous survey, we are having around 400,000 Kenyans who have disability need of a wheelchair. But we look at the situation or the prevailing situation in terms of how far we're able to produce these wheelchairs and how far we've been able to offer, there is still a greater need. I know a lot has been done, and many persons with disability have been reached with the same, but there is still a greater need for this. Yeah.
Okay. Now, Susan, I'll welcome your comment on this.
As we well all know,
and you can also tell us the plans for tomorrow.
Okay. So as you well all know, there is that for a law to actually have effect, it has to have mechanisms put in place which are direct, which are easy, and which are also implementable. So the enforcement of law is much more basically based on the mechanism put in place. So for persons living with disability, it has become a challenge, since the mechanisms that are put in place are either not effective enough, or due to the past notion that people living with disability are a nuisance to the society, or they are cursed and they cannot be productive members of the society. We need to change that perspective in regards not only to law, but also in educating the society in how the people living with disability can actually help us in developing our country in different ways.
All right. And Bright, of course, Benson will be telling us some of the challenges that he interacts with most of these persons. So he'll be telling us. But on what is going on, a report by the United Nations has revealed that apart from the economic impact of COVID-19, persons living with disability are experiencing a challenge, and this is maybe accessibility, or let's say in terms of healthcare. So do we have a challenge of accessing healthcare services maybe occasioned by the COVID-19 pandemic, Bright?
Absolutely, yes. Even before COVID-19, persons with disability had challenges accessing basic facilities like health. So COVID only comes to complicate matters. When you talk about accessible transport, for example, I need to get to a clinic in point A, I'm in point B. Now we are having vehicles, public service vehicles, with the conditions that they have to be, is it 60%, or I can't remember the percentage. Even when there was no COVID, it was very difficult for a person on a wheelchair to get into public transport. 1, it is not accessible. 2, you're not accepted. 3, you are considered to be luggage. So how much more now? So COVID has only come to complicate an already complicated story. So this has heightened the issue of accessibility and mobility for persons with disability.
And Benson, what are some of the things that ought to be looked at nationally to just ensure that the persons living with disability are, let's say, comfortable, you know? Yeah.
One of the key factors to be considered is identifications, because we really need to map out and understand the actual data in regards to how many persons with disability in Kenya need these wheelchairs. The second level is now doing the appropriate assessment. We understand a lot of well-wishers, a lot of partners are coming up with programs to assist either to issue wheelchairs. But what we need to do at this stage is to do an appropriate service provision, whereby identified personnel have to be really assessed to ensure that they are getting the right product in the market for them to be able to really move on well with life, so that they're able to live independently. So there is a bigger challenge of, 1, access to those wheelchairs. And as we all understand, the cost of these wheelchairs is not really pocket friendly to most of the wheelchair users. And you find we really have to mobilize resources by reaching to different partners, engaging from all over, from the government, non-government organizations, to ensure that we are coming up with resources to really allocate and ensure that there's enough fabrication for these wheelchairs.
And you know, what Benson is talking about is part of the mandate by the council, Susan, and I'm welcoming you to address that. But just before that, maybe would you paint a picture to us on how COVID-19 has affected persons living with disability, and if you have any cases reported among this group?
Well, the council has the mandate to actually ensure that assistive devices are being circulated to the people living with disability. So that's why the council, in collaboration with Kenya KRA, decided to waive import taxes onto assistive devices in order to assist people living with disability get the assistive devices that they need, so that they can be able to continue their day-to-day work. But the cases that I've received during this COVID-19 is either from people living with disability is the enormous medical bill that is they incur in actually accessing the basic medication or the basic physiotherapy that they require for a day-to-day. And also there are other, like children who have Down syndrome getting the therapy or the speech therapy or any other therapy that they require. It has become really difficult because most of the hospitals, either they are full or they can't travel to the nearest hospital to get the necessary therapy due to the curfew. So parents are they really have to struggle in the sense of providing the therapy at home, and yet they are not qualified to give the therapy. So as for the council, we have tried to make strides in doing accessibility audits on buildings, public buildings, or any other building that that is accessible to people with disability, because we are trying to promote a barrier-free society where they can be able to move and do that and be productive people in the society. As the only thing that we need now is to actually identify the actual ways of assisting them by not only categorizing all of them into one cluster of people living with disability. As we all know, there are different types of disability, and each one of them require different types of assistance, different types of equipments. So that
and Nafula, I want to stay with you and ask you to, according to the council, what you recognize as a person, as a disability, because we could be addressing different things here.
So a person with disability is a person who either has sensory, mental, or physical incapacitation in regards to actually doing their day-to-day life, day-to-day activities. And for us, you may categorize them as, for visual is a blind person, for physical is somebody either in a wheelchair, and then there's mental, they are the Down syndrome, and then there's or any other mental illness in the sense. But for the council, we do not clump all of them as to one. Each one of them has special needs, and we treat them in a different way. So for the accessibility audit, we normally take people with different types of disability into a building, and we actually see if they can actually access that building for it to actually be a barrier-free building or institution.
Bright, you are looking at Nafula suggestively. I don't know whether you agree. I do not know whether you agree with what she said about how the council is protecting persons living with disability. Do you think they have done enough?
The council has tried, considering where we were before it, but the council still has a long way to go. A long way to go in terms of even the definition. I am not needy. I don't need help. I need inclusion. I need capacity. I need belonging. So if we remove our mindset from a person with disability needs, so we are here, us, we are helping them, that's where the problem begins. We have to remove the mental barriers before we remove the physical barriers. So how a language has a way of telling you what somebody thinks about something. So even as a nation, we need to begin to look at persons with disability as people, because we say person with disability. I'm a person first before the disability. I have capabilities that are beyond the wheelchair. Actually, the wheelchair is a symbol of freedom, is a symbol of empowerment. It's what makes me move. It's not the other way around. Because many times when you appear somewhere on a wheelchair, there's less than kind of attitude. I think that's what we need to begin with. Once we deal with the mental stigma, it is very easy now to deal with the physical stigma, because it all begins in the mind. Nobody needs help. We need inclusion. We need belonging. That's the difference.
Benson, you're saying sure. I don't know when you're there advocating for the rights of persons living with disability. What are the things that you really want addressed?
First and foremost, we need to create awareness. There is a lot of misinformation or a lot of lack of awareness in regards to what disability is all about, the way Bright has just alluded to it, even from the definition itself. We really need to create more awareness so that we need the society at large to understand disability. And through this awareness creation and understanding, that sense of belonging and recognizing a person with disability as a person first will come automatically, because once you are aware, information, its power, it will give you that energy to really appreciate that disability is just part of our life. We need to embrace it. And more so, all of us are just prone to disability. Today is Bright, tomorrow might be someone else. So we really need to ensure that we are creating an environment that is very inclusive, so that by the time we are there, or for those who are already there, they have to really enjoy their life to the maximum, just like me and you, whom we don't have disability at the moment.
And before I get to you, Susan, let me go back to Bright. Bright mentioned that the wheelchair is a form of freedom, which I agree. Now, there has been an issue to do with mobility as far as persons living with disability is concerned. Is that still an issue, even as we look forward to celebrating the Wheelchair Day tomorrow?
Yeah, it's still an issue because for me, it's the environment that actually disables me. It is not what I find, the situation I find myself in. It is the environment. If there are ramps, if the walkways are wide enough, if the lifts for people with visual disability has sound, then that person is able to just run their life the way any other person does. So the environment really is the one that causes disability. And like I said before, it begins with a mental disability. I mean, with the mental barriers.
Okay, so we are winding up. I welcome Benson to say how best those barriers can be addressed. And of course, Nafula, you will make some promises because we need the council at least to assure these persons of that they're secure and like Bright was saying, they do not need help, they need freedom, you know. So please address those two issues in a minute.
Before handling the barriers, I can give more input about tomorrow's celebration. We'll be celebrating International Wheelchair Day in Kenya. Actually, it's the 3rd edition. There are 3 key objectives as to why this celebration is very key to us as Kenyans. One, we want to really appreciate and really enable or make the society understand the impact of wheelchair to the wheelchair user's life. There is a lot that has been enabled by just having a simple gadget, the wheelchair, in the life of a wheelchair user. Secondly, we want to really appreciate hundreds or many people, many stakeholders who are involved either in production, in supporting, and ensuring that those who have been rich are able to get these wheelchairs. We want to take this time to really appreciate them because they're doing a noble cause. And finally, we want to really create the awareness and let the society understand, despite all the effort that have been made by the government, the National Council, and all other key stakeholders into this, there is still a greater need for the wheelchair services.
All right, thank you so much, Benson.
Yeah.
Yes, it's over to you, Susan.
Okay, as a council, currently we have made some few changes in the council. As you all know, we have a new executive director, and he has a vision to where the council should be and where it needs to be to head towards to. So in educating and promoting awareness, we are going to have our first ever legal aid clinic at the National Council on 10th March 2021. This will help help people with disability know their rights and understand their rights and to identify discrimination in whatever environment they are in. So that is the first step that the council is doing in regards to creation of awareness of rights with people with disability, and also other things will be coming soon, which I can't list them all of them here, but that's the main important one.
Thank you so much. And of course, inclusion and do not stigmatize persons living with disability is what we are taking home tonight. Susan, Bright, and Benson, thank you so much for your time. Don't go anywhere. We still have another conversation, especially on the schools unrest in the country. So do stay tuned for that as well.